Hello everyone, this is Dr. PK. I'm a board certified internist with decades of experience in internal medicine. And today in this video, I'm going to talk about blood thinner. So, it's a common issues we face every day as an internist. And of course, there's a cardiologist involved in care of the patient. But I want to talk about some basics about blood thinners. Why do we prescribe them? What's the different types of blood thinners? And what are do's and don'ts while you're on them? Stick around, and this could be very helpful, and this could literally save a life. So, why do people take blood thinners? Blood thinners do not actually thin your blood. They prevent blood clots, and clots can be deadly. And here is why we use them. Number one, heart condition, atrial fibrillation. The rhythm is irregular. It causes clot risk, and that can lead to stroke. And I see at least few cases every year, patient with atrial fibrillation who develop clot because they're non-compliant, they forgot to take medication. Mechanical heart valve, especially metal valve, they create a high risk for clot, so they need it as well. Coronary artery disease or after a stent placement, to keep blood flowing, we use blood thinners. Venous conditions, deep vein thrombosis, we call it DVT, or pulmonary embolism, PE. Life-threatening clots can migrate from your calf vein to the lungs, causing many problems, including death. So, blood thinner is used in those cases where we are able to recognize the reason why patient is in ER and start the treatment right away. Stroke prevention. If you had a stroke or TIA, which is transient ischemic attack, TIA, we often need long-term anticoagulation. So if you are on blood thinner, your doctor believes you are at high risk of a dangerous clot. That means the doctor is going to put you on blood thinner. So there are two different types of blood thinners. One is called antiplatelets, other one is called anticoagulant. Antiplatelets, they keep platelets from sticking together. For example, aspirin, clopidogrel called Plavix, or ticagrelor called Brilinta, or prasugrel called Efient. They're commonly used in a heart attack, after a stent, or stroke prevention. Anticoagulants interfere with the clotting proteins in your blood. An example is warfarin, which is coumadin. So old school medicine and requires regular blood testing for INR or protein. There are some other direct oral anticoagulant, and they're called DOACs, DOACs, direct oral anticoagulants. Common ones are apixaban or Eliquis, rivaroxaban called Xarelto, and dabigatran called Prodexa, and idobaxan called Savesa. And they are used for atrial fibrillation, deep vein thrombosis, pulmonary embolism, and mechanical valves. It's important to note that warfarin interacts with the food like spinach and other medication, so it needs blood test monitoring. And DOACs are easier, like apixaban, Xarelto. They're easier because they don't require blood test and they carry lesser bleeding risk. Here is what you must know while taking any blood thinner. Bleeding is the number one risk. nose bleeding, gut bleeding, easy bruising, blood in the urine, stool, or brain bleeding, which are really dangerous. What not to do? Do not take NSAIDs like ibuprofen or naproxen unless cleared by your doctor. Avoid contact sports or falls because they carry a big risk of bleeding. Tell your dentist or surgeon before any procedure. No alcohol binging because alcohol together will increase bleeding risk. What do you do when you're traveling? Bring your medicine. Get a medical alert card or bracelet saying that you are on blood thinners. When to call your doctor? You must call your doctor or go to emergency room if you notice black or tarry stools or vomiting blood or coffee ground material, sudden severe headache, unexplained heavy bruising, persistent bleeding from gums or any cuts, or missed doses. Just don't double up. Talk to your physician. Common myth, and patient would usually ask me, can I eat leafy greens on blood thinners? The answer is yes and no. If you're not eating green leafy vegetables, then you should not be. But if you are the kind of person who loves salad, you can be on it, but make sure that you eat your salad consistently. So if you stay consistent with kind of food you eat, including leafy vegetables, the dose of warfarin will be adjusted accordingly. Can I stop taking it once I feel better? Never stop on your own. Even missing a couple of days can cause clot. Can I take supplements? Be cautious. Fish oil, turmeric, garlic, ginkgo, they all can increase bleeding. So talk to your doctor first. So blood thinners save life, but only when you are taking it correctly. If you're unsure about your medication doses and interaction, talk to your doctor, not Google. Like, comment, and share. If this helped you or someone else you love, I'm Dr. PK from DrPKlyfe. Remember, take control of your heart health and one informed decision at a time. Thank you for watching.